Do you suffer from lower back pain? Well, if so, what do you do about it? Well, that's exactly what we're talking about today with our coastal expert from the Joint Chiropractic. Joining me now is Dr. Tanya Harris. I'm so happy to have her with me. Hi, Dr. Harris. It's great to see you.
Hi, Natalie. How are you today?
Just fine. So lower back pain. We often hear people say, oh, my lower back hurts. What are some common causes of lower back pain?
Well, to start off, I want to talk about the structure of the actual low back. Now, it includes the last 5 movable vertebrae called your lumbar vertebrae, and it also includes your pelvis and your sacrum right between here, which is between that last movable lumbar and your tailbone. Now, what happens is, as you're going throughout your everyday life, you're not always in pain, and it usually doesn't start out as low back pain per se. Now, your body's going to change and adapt to positions that you're in every day, and what happens is your body shifts. And then as it shifts and moves, the muscles may tighten up on one side versus another. The actual bones may rotate a little bit just because it's going to take some pressure off and allow you to move a little easier. But over time, that stays in one place, and that puts extra pressure on the nerves. That may cause disc swelling. That may cause the actual bones to move out of alignment and put pressure on the nerves themselves. What we don't want to do is just focus on the pain per se, but it is something that happens to a huge percentage of the population.
But it's not necessarily always due to an injury like we all think. I mean, maybe you sit at your desk all day long in the same position, or maybe you're in an odd position and somehow you find that same odd position every day.
Of course.
That's something I would assume that could aggravate and start lower back pain.
For the majority of people, it is due to their postures, their normal everyday positions, their daily activities. Those things can definitely cause pain, and your body's going to move to help shift. But after a while, it can only shift so much without putting pressure on the surrounding tissues.
So who is the most susceptible to having lower back pain?
Now, something that's interesting is that research shows that about 80% of the adults in the American population will have low back pain at
80%?
Yes, 80%. And over 50% of those individuals are in the seated position a lot throughout the day. So that puts a lot of pressure on these nerves in your low back. That's when you bear the most load, is when you're in the seated position.
But this is something that doesn't just happen to older individuals.
Of course,
I mean, it can happen in the younger generation as well.
Yes, yes. Any type of bending, twisting, and even lifting can put excess force on the low back and cause misalignments in the lumbar spine.
And of course, young people are in school sitting at desk all day, just like the older folks are sitting in desk, you know, as they get older. So I could see that working the same way in that respect.
At the Joint, we see lots of teenagers and even small children that have low back pain just from exercising, going outside, running, playing, of course falling, but you know, those things can cause pain later on as well.
So what are some long-term results if the lumbar spine remains out of alignment?
Now, misalignments will put extra pressure on certain tissues.
Okay.
Now, what will happen, this is your shock absorption. So as you're moving around and about, that's what's taking the grunt of the force. The bones are a harder substance, so they don't take as much force. When you move around in different positions and the bones become misaligned, just like if I move it here, it's going to allow this to move in a different position. So that may cause disc herniation, disc swelling. Some people have slipped discs to where their bones will come from underneath each other because the body's just been bearing that load for so long. And later on can lead to osteoarthritis, herniated discs, things like that, and also a lot of muscle spasms. We forget sometimes that muscles attach to these bones.
Let's say somebody is suffering from back pain and you know they've been on pain medication for a long time and they really just want to go to something more natural. When can they expect to see results?
Now every case is different. I don't want anyone to think that one adjustment's gonna fix the pain aspect of it, but what can happen, what people notice more than anything, is they notice that they're able to walk a lot differently, they're able to sit a lot differently, they're able to move better just after their first adjustment.
And with the continued therapy, it may just change their entire
Right.
way of life.
It definitely will. I have had patients that have decreased their pain medications because they're not in pain as often and they're not feeling the way they were that led them to take pain medications in the beginning.
Well, I know I received a lot of relief when I had my adjustment. A lot of viewers out there watching right now, Dr. Harris, and maybe they're sitting there right on their couch thinking, gosh, you know, I suffer from lower
Right.
back pain and I have for years. What would you say to them, and what do they need to do to give the Joint Chiropractic an opportunity to help them?
I think the first thing is to come out, get examined. We'll create a detailed care plan specifically for them and their needs that will allow them to get out of pain as soon as possible. And also, the sooner the better. The longer you wait, you may have other issues further down the road that are irreversible.
The most important thing is starting a conversation and dealing with an expert like the folks at the Joint Chiropractic. Don't suffer.
There you go.
Well, Dr. Harris, I want to say thank you for coming in and providing us with this great information.
It was my pleasure, Natalie.
It's always great to see you. If you'd like more information on the Joint Chiropractic or any of our Coastal Experts, just go to the Coastal Experts page. You'll find that at wsav.com.